I'm Dr. Kamal Kiran. I'm a nephrologist and the transplant physician at Medicover hospitals. I'm the director of the transplant program here. The main significance of this lovely event is that we have successfully completed 100 transplants during the worst of COVID times. And the significance of this is, during COVID, you couldn't even get out of your house to go to a hospital, and that was the main problem for our dialysis patients and others. In spite of the logistical challenges that we faced and the problems that anybody could get COVID, we were still able to pull off 100 transplants. The 100 transplants, we are the fastest in the country to achieve this in this COVID times. And the main significance of this is the importance. CKD patients or chronic kidney failure patients will require dialysis, and those on dialysis have a high risk of dying because of COVID. In the last 1.5 years, we have seen that out of 130 patients who started the dialysis program, 25 of them had to pass away because of COVID, unfortunately. At the same time, the 100 patients that we transplanted successfully without any problems, they could have probably contracted COVID, but none of them had a serious effect of COVID, nor a hospitalization, nor a death. So we're proud to say that we had a 0% COVID morbidity and mortality in the patients who underwent transplantation, as compared to a 25% mortality in the patients who were on the dialysis program. For a patient with CKD, out of the two choices that he has, dialysis and transplant, transplant is definitely life-giving, life-saving, and gives the patient a completely new lease of life where he can work, play, and be with his family for the rest of his life. The commonest causes of kidney failure is diabetes, which is accounts for almost 40 to 45% of the patient population who have kidney failure. The rest of them is hypertension, genetic disorders, kidney stones, painkiller abuses, and autoimmune or antibody-related problems. So these are all the common ones that we see. In India, definitely we expect that 1 out of 10 people have some form of a kidney disease, and 1 out of 1,000 people will definitely be on dialysis. So in a country where we have a 140 million population, we are talking about extremely high numbers of dialysis patients or CKD patients. The normal estimation is that at least 10 lakh patients should be on dialysis at any given point of time. However, in India, only 1 lakh patients are on dialysis because of lack of awareness, lack of hospital facilities, and lack of transportation to the nearest dialysis center. Because dialysis involves going to the dialysis center weekly 3 times for 4-hour sessions each time. But on the other hand, when you get a transplant done, all you have to do is visit your nephrologist once a month. The rest of the time, you can continue your work, you can continue with your life, regular lifestyles and other things. So, for a patient with CKD stage 5, dialysis is not the way to go. Transplantation if possible. Being doctors is just not about treating patients. We are also into research related activities, and COVID has thrown new challenges towards us. We have strived to understand a disease which we had never known, and most of us have got an experience about COVID for just less than 1.5 years. Say diseases like malaria or typhoid or tuberculosis, hundreds of years of experience has been there in the world literature. Our COVID was a very quick learning process for most of us, and we are still learning about COVID. What we have found is the patients who had been transplanted, COVID could not touch them at all, and we are ecstatic about this compared to dialysis or any other major problems for that matter. Patients with kidney failures, patients with diabetes, patients who are obese, patients with cancers had a very high mortality during the COVID wave. But transplant patients were luckily, miraculously saved from the ravages of COVID.